Hi, welcome to the section of cardiology. This is Dr. Jaitly. In this video clip, I'll be discussing very briefly, but the basics of how diabetes affects someone's heart. We know diabetes is a fairly large population all over the world. A large chunk of people, all ethnic groups, all countries have a prevalence, and it is increasing, unfortunately, because of lack of activity that we're increasingly getting into, and our food habits, and our weights, body weights, etc. They are constantly changing. But nevertheless, there are two major risk factors: family genes and obesity, which are definitely prevalent and makes one prone for diabetes per se. So diabetes, the full form is diabetes mellitus or mellitus, DM. It is the hyperglycemic state where the sugar states are high in the blood, in the circulating blood, and it normally is resulting from a lack of insulin production or failure to meet the needs of the body as far as insulin is concerned. Obviously, there are type 2 types, type 1 and type 2. The type 1 is where it's complete or near complete absence of insulin. That is normally present only in young individuals. It's called, previously was called juvenile diabetes. Now, these people can only survive, type 1 diabetics can only survive if they receive insulin at a very, very early age, as soon as it's detected. Otherwise, the survival is impossible. Type 2 normally presents past the age of 35, 40, and this is the predominant type of diabetes as we see, and that normally requires initially medications to increase the production of insulin, or the utilization of insulin in a better way, or eventually they will also become insulin dependent. But that's the treatment of diabetes, and we'll discuss that beyond this video. But right now, let's understand what is diabetes and how does it affect the heart. So diabetes predominantly affects the heart and the vascular system in one definite way, and that is increased plaque production. That means there is a progressive plaque formation. Say in a non-diabetic, the plaque will proceed like this, but in a diabetic, the plaque would proceed a little more abruptly in this fashion. So, and the plaques are within the arteries. Now, here are the arteries. This is the prototype of my favorite diagram, where I'm showing the coronaries running outside of the heart, and these coronaries, they tend to develop plaques all over, and as a result the person can develop angina or heart attack. So one thing for sure, that these patients who develop increased plaque production or formation have increased tendency because of the following. One, their blood tends to have an inflammatory component to it. And because the blood has a marker called C-reactive protein, which is present, their LDL is high, the inner lining of the arteries tend to be more prone or subjective to plaque formation in a setting of diabetes. There's a higher risk for stroke, obviously, because the brain arteries and the carotid arteries will be involved. There's an increased risk for kidney disease because the renal vascular arteries are involved. So arteries, wherever throughout the body, they have a similar plaque formation in proneness, if you will. And obviously in the coronaries, one can develop more often the heart attacks. Now, normally when the patient is having a heart attack, when he or she is not a diabetic, the classic symptoms, as we have already discussed in the previous other video presentations, are chest pain, pressure, tightness in the center of the chest, radiating down the left arm, accompanied by shortness of breath, nausea, vomiting, and sometimes extreme sweating and dizziness. All of these symptoms will be lessened or will be less prominent in a setting of diabetes. And the reason is because they have the nerves that are going around the heart. They're also involved in a setting of diabetes. And plus, the patient does not feel these symptoms that prominently. So many times even it's called a silent heart attack. That means a patient can present because of extreme tiredness, fatigue, or as if like it's not recovering from a flu-like symptoms for a few days, a week or two, and then presents to the doctor's office, and the doctor runs an EKG, and that suggests that the patient may have suffered a silent heart attack. Many times they present to the emergency room for vague symptoms of, again, tiredness or fatigue, and as a result, and in EKG one can see many times it's just detected only after years or months if it's a small silent heart attack. So the point I'm making is the symptoms are less prominent in diabetic patients as opposed to non-diabetic patients. The inner lining of the arteries make the diabetic patients more prone for plaque formation. Blood tends to coagulate more often in a diabetic setting. And even other risk factors like high cholesterol or smokers or obesity or physical inactivity, all those factors are just compounded by diabetes, and their incidence is higher. The heart disease incidence is higher based on the same risk factors. In other words, all those risk factors become more problematic in the presence of diabetes alone. So is diabetes a risk factor? Yes, it is a very prominent risk factor for heart disease and vascular disease in general, also for stroke and renal vascular diseases, as well as diseases in the arterial system to the lower extremities. So please take diabetes very seriously, and therefore it needs adequate control first, and in order to prevent any further vascular damage or arterial damage to your heart or to your brain or to the arteries that are supplying the vital organs. Thank you for your attention, and see you next.